When a patient has difficulty breathing, a respiratory therapist is often one of the first healthcare specialists called to the scene. Respiratory therapists, or RTs, are specially trained to provide a wide range of therapies and diagnostic services to people with lung and heart problems. Their combination of skills makes them experts in blending technology with personal patient care.
When I got into the profession, I thought it was just taking care of patients in the intensive care unit who are on breathing machines. Since I started and got more familiar with the profession, the roles have expanded so greatly and diversely across the hospital. We seem to be the logical choice for a lot of additional tasks in the hospital and working in different areas.
In Ontario, respiratory therapists are regulated and licensed healthcare professionals, the same as physicians and nurses. They are essential members of the healthcare team, caring for patients across a wide range of ages and in a variety of settings.
As a respiratory therapist, day to day you never know what you're going to experience when you come to work. And that's something that drives some people. They don't want to be bored. And this is definitely a career that will keep you moving.
I feel like I'm a part of the team, that I need to be here to recognize that kind of thing and to potentially save a child's life. That's what we're all here for.
The education and skills of respiratory therapists make them vital members of Canada's healthcare system. It's a profession that requires a blend and balance of strong people skills and a full understanding of science and technology. RTs provide direct patient care and education to help patients and families manage chronic respiratory diseases like asthma and chronic obstructive pulmonary disease, commonly referred to as COPD.
As a respiratory therapist, my day changes by the moment, and my week will be different from week to week as well as day to day. We will help patients with learning about their lung diseases, whether it's asthma condition, whether it's a chronic lung condition called COPD or chronic obstructive pulmonary disease. We'll teach them about those diseases, we'll help them learn about their medications, how to handle activities of daily life in a better way that they are more suited to be able to enjoy their lives.
They are also responsible for the effective functioning of life-saving equipment and may have careers in the sales, service, and training associated with that equipment. Respiratory therapists are educated to treat patients across a wide spectrum of ages. This can include the care of newborn infants, children, adults, and seniors.
What I do as a respiratory therapist in the OR is I assist anesthesia. Respiratory therapists, our specialty is airway and ventilation, and that makes us tailor-made to assist anesthesia. Sometimes it actually is saving a life when you can do something that needs to be done, and it gives you a rush. It makes you feel good that you've really made a contribution to society. You feel good about your job.
I feel strongly that we have a very important role in healthcare as RTs. We have an excellent opportunity to deal with patients directly, to provide them reassurance and particularly a very vulnerable time in their life.
Most new graduates are drawn to the fast-paced, demanding areas of critical care. For example, treating trauma victims, managing life support, or attending to high-risk infant deliveries.
My role as a respiratory therapist is really looking at promoting excellence in respiratory care, which is really why we're in business. We're in business not just for the immediate acute period, but we're hoping that we make these infants be the best that they can be. Having been doing it now for 18 years, I'm extremely satisfied, not only in my profession, but in my colleagues and in the work that we do here.
In this field, working so closely with such critically ill children and adults, it's very, very important that you have at least a little bit of life experience going into that so that you can handle the day-to-day emotions and the day-to-day trials and tribulations of this field. You really have the opportunity to not only impact patients but to impact their families and to have a really amazing influence on the lives of children and their families. Specifically in the neonatal ICU, I can think of one experience in that, and one of the reasons that made me get into neonatology is that I myself as an infant was very, very premature, and I had a mother a few days ago who was just beside herself that her child was so premature, and were they going to be okay, and what kind of problems is my child going to have, and was just really, really understandably upset. And I was able to sit down with her and say, I was younger almost 30 years ago than your child is now, and look at how far we've come with medical technology. And just to have that look of relief wash over her face, if I could do that one time every day, that would just be fantastic. But it was so amazing to me to be able to give her that sense of relief.
A career in respiratory therapy can also lead to positions in health administration. Therapists work in areas such as infection control, management of outpatient clinics, discharge planning, and case management. But it's important to understand that their primary role is in providing direct care to patients. When SARS caused a health crisis in Ontario, respiratory therapists were on the front lines. When you cannot breathe on your own, the best person to have at your side is an expert, the respiratory therapist who can help you take that next breath. Career opportunities for the profession are increasing. Respiratory therapists are taking on advanced practice roles with expanding responsibilities. And as the population gets older, there is an increase in age-related cardiopulmonary disease. Both are factors leading to an increase in the demand for respiratory therapists.
If you're looking for a career that is fast-paced, always changing, isn't the same thing every day, and you can't plan your day, then this would be something for you to do. Very active, it's not a desk job, and you should never get bored of it because it's different every single day.